The government today has spoken out. The Union Health Ministry here in India has given out a word regarding concerns and fears of the mutation of the COVID-19 virus, which is now known as the new strain of COVID-19. Niti Aayog member VK Paul here has said that the mutation of the new virus is not affecting the severity of the disease, which effectively means here that it's not causing any change in symptoms of those who've caught the virus. The case fatality is not affected either. Now, he has further said not to panic over the mutation, as the new strain of the COVID-19 virus is seen in UK has still not been detected or reported in India.
अभी तक जो दिखाई देता है उससे लगता है कि ऐसा नहीं है. This mutation is not affecting severity of disease as we understand today. Number two, does it increase the chances of death in that country जहाँ से आया, क्योंकि वहीं का ही ये knowledge है अभी? The answer is no. So the case fatality rate is not affected by this mutation. Hospitalization is not affected by this mutation. Seriousness of the disease is not affected by this mutation. What is affected is tendency to infect more people.
The central government also, in fact, has issued a detailed set of SOPs now, which have been just announced, and this is to deal with the situation. In these guidelines, the Health Ministry has also said that all UK passengers who are travelling from the 21st to the 23rd of December would be compulsory for them to undergo the RT-PCR test right on arrival at the airport itself. Those who are testing positive should be isolated, and this is going to be institutional isolation at the facilities that are being provided at respective state governments. Now, this comes in because 8 of the UK returnees have now tested positive in 3 days in India. While the first UK returnee is from Chennai, 5 have tested positive in Delhi, and 2 of those who returned from the United Kingdom have also tested positive in Kolkata as well. Let's get in more voices here on this. We have Dr. Rakesh Mishra, virologist, with us on the phone line. Dr. Mishra, many thanks for being with us here this evening. In your view, and what has already been stated and spelt out by the Health Ministry on these concerns that are being raised on the new strain. Of course, there is going to be a lot of backtracing of the cases that have been reported on those who also have arrived even before the travel ban here came in. What are largely your concerns in what has been reported so far?
See, the main concern is that although there are no symptoms worse than what is already known in the other variants, but we know that from the data available that this variant spreads very fast. So which means we have to be more alert. There is no need to panic, but at the same time, if the cases number increase very sharply, that will lead to secondary problems like crowd in the hospital and so on. So we'll have difficulty in saving people who otherwise can be easily saved. So that is why prevention of spread, reduction of the spread is something very important. So the steps that have been taken of cancelling the flights and tracking people, that is very important. Also crucial is we don't know since when these variants may be entering. So we have to do testing at very large scale, testing which is RT-PCR testing, and then sequencing certain % of the positives so that we can very quickly map where this variant is in India, if at all it is there. And then we can try to restrict movement and spread from those individuals. Till then, I think everybody should assume that other person may be having the same variant and therefore be very careful. Because the symptoms are not very worse, we can manage it if we prevent the spread and keep the speed in control.
All right. Many thanks, Doctor, for speaking with us here. Of course, this is in keeping in mind all the precautions that have been announced, even though right now India is fortunate. So far, we haven't reported the new COVID-19 strain from UK that has been reported. None of these cases reported in India yet.